This video will talk about the automated external defibrillator. When you open the unit, you'll see the unit on the right and the compartment with the pads on the left. The unit that you'll be using during the study will be actually colored blue. At the top you'll see the on and off button, and on the bottom the shock button. On the top left hand corner is the outlet where you'll plug in the connector. These are the pads. Just open up the package, and when you pull them out you'll see pictures on the pads that should help guide you where the pads go. Now when prompted, put the pads on the patient and it'll tell you to plug in the connector, and you just plug in the connector into the slot on the top left. Now this next video is going to talk about applying the defibrillator. As soon as the AED arrives at the scene, stop everything that you're doing and turn on the AED. Just follow the prompts. So in this case the prompts were put the pads on the victim's chest, so in this case upper right and lower left, and then to plug in the connector into the outlet where you can see the light flashing at the top left of the defibrillator unit. Once the connector is plugged in, you'll be prompted that the defibrillator will be analyzing. So at that point, it's important to make sure nobody is touching the victim. When you're prompted to shock the victim, just make sure that nobody is touching the victim. And then just press the shock button.
Pause. If needed, begin CPR.
So here are the key points. As soon as the AED arrives, just make sure you stop CPR and apply it immediately. You want to minimize compression interruptions, so if you can get somebody else to do the compressions while you set up the AED, or vice versa, that is the best situation. If you have the choice because you're by yourself between applying the AED and doing CPR, you have to stop CPR and apply the AED. Beware of metal and water. If there's water, you can do the splash test, which means if you slap the ground beside you and there's an actual splash, then you have to move the person to a drier surface. Be aware of the chest. Make sure you remove any water on the chest, excessive hair. If there's a medical patch, remove that as well. Just make sure you have your gloves on. If there's a pacemaker, just make sure the pad is about 1 inch away. Be sure to follow the prompts. Just remember that the pads, one goes on the upper right and another goes on the lower left. And last but not least, during the analysis or in preparing to shock the victim, make sure you just verbalize for everyone around you to stand clear so that nobody is touching the victim at the same time.